Today I'm going to talk to you guys about chronic and recurrent infections, and people don't think about things like sinus infections, they don't think about UTIs, they don't think about these things as chronic infections. And as we go through the slides, what we'll start to see, and I'll explain to you, is why our pharmaceuticals are actually so inept at getting rid of them. So we're going to talk about biofilms. What are biofilms? How do you detect them? And how do you eradicate them? Because these are the things, and think about biofilm, how it acts. These are things that you take your antibiotics, everything gets better, and then 3 to 5 to a week later, all of a sudden you have the same thing again. And you go back in for another round of antibiotics. Now there's a big problem with that, because we have trillions of bacteria inside our gut. They produce our hormones, they produce our neurotransmitters, they produce everything that has to do with the brain. And every time you take an antibiotic, you can actually damage the microbiome permanently, depending on which one. So a lot of you guys have taught me, see me running around the high school years ago. But I've been in private practice since 1995. I am a chiropractor. I am a licensed acupuncturist. I went back to school when my daughters were born because they were both born with mitochondrial disease. So I took a very big interest in what are mitochondria, what allows them to work, and how do we help, or how do I help my daughters have a better survival rate. Kalish method. This is an offshoot of functional medicine, of the IFM. Basically, I'm triple certified in functional medicine. I'm one of about 2,000 people in the world that is certified like this. The IFM is the big Harvard of functional medicine. There's the University of Functional Medicine, and they give you a lot of tools. So they tell you things, take mastic gum for H. pylori, and they give you these tools, but they don't give you a system with which to start to assess people with. And so the Kalish method is one of those things that says, hey, when you're looking at a person and you see this wide open range, how do you start to clue in on what you really need to treat? And so that's what the Kalish method actually does. I also interpret all the labs for virtual clinics, so if you go online and look at Virtual Clinic MD and you submit a blood work or a functional medicine lab, I'm actually your reader, and we will have a consult and talk about it. I also present for Transformation Enzymes, Virtual Clinic, and Diagnostic Solutions Laboratory. I'm cheating today. You're getting my presentation from Transformation Enzymes, just really condensed. So a biofilm has 6 phases to life. When you see that first one, that's the planktonic phase. So what happens is, this is where if you catch something early, if you're really in tune with your body and you're like, something's just off, you go get the test at the MD and they say, hey, you got this, you get the antibiotic, boom, it's done, it's over with. You've caught that in that phase. If you're like most people and you go, it'll go away, then part 2 and part 3, they start to implant on surfaces inside the body. These things want to live. They are living creatures. So when you see that slime layer starting to form, that's what makes them antibiotic resistant. Most medications, and I don't remember if most medications are positively or negatively charged. I think they're positively charged. That film is also positively charged. So what happens when you try to take 2 positive poles to each other? That's how it repels the medications. And then they will sit there and proliferate. They'll grow and grow and grow until the community says, hey, we're too big, they break off, and you go again. Another classic illness is Lyme disease. If you know anybody with Lyme, you know that this stuff circulates around and around and around, and they go through phases. And so when you start to actually treat biofilms, this is how we treat Lyme. And we've treated people for Lyme from New York to, I think I had one in the Czech Republic. So throughout, and it's actually very successful if people will address the biofilms. And we don't use antibiotics. I don't have scriptive powers. So when you start to think about these things, here are illnesses that are actually associated with biofilms. And so I'll let you guys read that. I'm not going to, I know you all can read. So
no, we're used to having principals. They read everything.
Read it for you. The big thing about this is as you start to get these things, the older we get, and almost everybody here is over 50, things in our body just aren't as efficient. And so the more that we have what we call the Western American lifestyle, high sugar, high carbs, low nutrient density foods, our bodies become very, very inefficient, and they can't fight off the things that it used to fight off. We are a food first clinic. The first thing we start to do is go through people's lifestyles. We address sleep, nutrition, exercise, stress, and community. That's where we start, because if you can't get that stuff in line, don't waste your time or money. What we use to actually assess this is the GI map is my primary tool, and this is a microbiome assay. What this means is you get this little French fry boat and you're going to poop in it, and then you're going to take samples out of that with this little scooper, and it goes into a tube. You shake it up, drop it in the mail, and then it comes to me eventually in a nice readout. That assay tells us what your microbiome looks like. Now, there is no perfect microbiome. We know what a healthy microbiome should look like, and so we can start to manipulate foods. So a lot of people, I don't know how steeped into the microbiome you guys are, but there is a keystone species of bacteria called Akkermansia muciniphila. And if people are listening to all the GLP-1 inhibitors and stuff, they are all starting to hear, hey, you've got to have this Akkermansia bug because it's what makes a big difference. Well, then they want you to take this probiotic. The Akkermansia bug is extremely hard to cultivate. You have to be in a nitrogen-based, sterile environment to get this sucker to live. The minute, they said, the analogy is if you take a dropper and drop one drop of acid in a pool, an Olympic-sized swimming pool, if you have the amount of oxygen in that dropper hit that pool, it kills the bug. That's how sensitive, it's an anaerobe, that's how sensitive it is to oxygen. You have to have it. So this tells us, do you have the keystone species? Do you have what looks like a normal amount of commensal bacteria? A lot of people don't realize that you actually have Pseudomonas and Klebsiella, and these guys are bad players when they are allowed to overgrow, but you're supposed to have them in minute quantities. It's just like our kids. We watch our friends, our kids have. Why? Because if they start to run with the wrong crowd, they start to do the wrong things. The microbiome is no different. If you allow a family called firmicutes to overgrow, it's highly inflammatory. It starts to make arthritis really kick in, and it causes bad things to happen. We can start to see that with this. The omics is a blood test, and omics it's an organic acids test. So we can see if some of the organic acids are off, and this gives us an idea that, hey, there's some bad players in here and they're overgrown, we need to start knocking them down. Once again, you guys can read this. The big thing that everybody should take away about running a stool test is most people only think about a stool test as being a gut test. The problem with that thought process is you don't have to have GI symptoms to have a problem with the gut. If you have skin issues, if you have other rashes, irritations, allergies, these are actually, or have actually all been related to the gut. This is what one page, and this is the page that I look at to see how the microbiome is set up and do you have bad players. So when we start to see that, if you look behind them, I have my little cheat sheet on there, biofilm former. And basically, any of those that have biofilm former behind them, they like to implant on the surfaces of the body. And when they do that and they start to form that film, the funny thing about that is bacteria can actually start to hide in that film with it because there's bacteria, viri, all in that slime layer. So people who have candida issues, candida likes to hide in that biofilm. So if you have a staph infection on there, staph, so about a third of the way down on that top, if you have a staph infection, well, that causes biofilm to form. And that's why people have such a hard time getting rid of staph. What happens if you're in the hospital and you get staph? So now, when you start to look at this, what causes or what allows these things to form? And I've got a whole rant on foundational health of Americans. I just actually did a speech in Columbus. I did one up there and we were talking about foundational health. And our foundational health in America is horrible. And number one is the main reason why. Because we choose convenience over quality. And so when you are eating stuff out of packages, when you are eating stuff that sits on the shelves, when you're doing this stuff, you're not giving your body what it needs to clean out, to go, to do the functions that it needs to do. Who knows how much fiber you should have per day?
38 grams. 38 grams.
That's actually, we say 25 to 40. Most Americans only get 8 to 12. So if he's shooting for 38 and getting it, great. My coffee has 19 grams of fiber in it. I start my day with fiber. I use something called Ultra GI Replenish. I use Inflamex 360 and Endothin. These are all very heavy fiber things, and that's what my coffee is.
It tastes awful.
Or better. Yeah.
It's a little thick. The next thing that allows people to get biofilms is poor digestion and slow gut motility. If you're not eliminating every day, then you have a problem. Things are allowed to back up in the gut, they're allowed to ferment in the gut, and then what happens? What's the gut supposed to do? The gut breaks things down, pulls it into the bloodstream, so then the cells, the mitochondria, and everything can use that to start to heal you, keep you healthy and whatnot. If you have stuff that sits in the gut, then those toxins get actually reabsorbed. Prescription drugs, they kill off the microbiome. Unfortunately, a lot of the good bugs in our body are very susceptible to prescription drugs. So when we're taking prescription drugs and antibiotics and things like that, we actually kill off the normal flora first. So then, here's a pro tip. So then when you are trying to come back from whatever illness, fermented foods. Those things are great. Lots of lactobacilli in them. You can always go get your probiotics, but I think the GI map tests 320 different microbes, and that's just scratching the surface of the trillions of microbes that we have in us. So here is a 52-year-old male that came in. He had skin itching, rash, weight gain, no energy, bad gas, acid reflux, and he's pre-diabetic, high blood pressure. That actually at first blush doesn't look bad. But I've been doing this long enough that when I see Pseudomonas at an E to the 9 and the lab range is E to the 4, you have a very bad infection at that point in time. That means that he is 5 times larger than what he should be. His family is 5 times overgrown there. So each one of those it's math. It's an exponent. So
This comes from the stool sample.
Mhm.
That's,
Yep. So then we started the treating. And this is after about 6 months. And remember when I told you things hide in the biofilm? Well, look at his Pseudomonas. It went from 9 to a 7. So we've peeled back layers of paint. I try to make the analogy up. And look at how much stuff was in there. Now by this time, he's feeling great. He's like, I still can't lose weight. And I'm like, yeah, you got all this stuff still in there. And we still have to dig through about 3 more layers of this Pseudomonas to see what's actually there. And you gotta clear it out. And then the other thing to look at, you see that inflammatory autoimmune related bacteria? Those bacteria are in us all, but we can't let them overgrow. And when they overgrow like that and they're there, that's when you start to get arthritis. That's when you start to get all the itises, all the inflammation. That's all. Wish Mom was here. Hey Mom, what does itis stand for? And it's just inflammation. It's just swelling. As I said earlier, to do this, what we do is we address sleep, nutrition, movement, stress, and community. I have yet, knock wood, make sure I'm not exaggerating, I have yet to have anybody have to go into taking like a major antibiotic. I haven't had to refer anybody out. Sometimes you want to almost sterilize the gut and then bring it back. I haven't had to do that yet. Now we've seen some pretty hairy cases, but it takes time. And we talk to our patients. Do you want to do this quick and dirty, or do you want to take the slow, let's dig in and get everything out process? And most people are wanting, because they tried the quick and dirty already, and that's how they ended up where they're at. So then they start to do the process. When we are redoing the microbiome, this is 6 months to a year. And that's also by design, because we want you to change your lifestyle. So then if you want to go out, and my athletes, they want to go out and they want to go have a party and they go celebrate their wins and stuff like that. My professional athletes, they will go do their things, but then they know how to clean themselves up, and they're not dependent on me. That's the other thing is I don't want people dependent on me. I'm kind of lazy. I don't like taking those phone calls. You know how to do that. You know how to clean that up. Things that you can eat that help get rid of biofilms. The other thing is now they know that they're so powerful that you can get garlic that's refined, oregano oil that's refined, black walnut, uva ursi. You can get all of those types of things in supplements that help you knock these things down. And here is, if you go onto our YouTube page, you'll see where I have interviewed different people, and there's one guy that is my Metagenics rep. And he tells me about New York going in and pulling off certain, I think they did probiotics and they did other vitamins, and they started to do independent assays of vitamins. And I'm just here to tell you, when you are buying vitamins that are the cheapest, you get what you pay for. There is a tremendous amount of fraud in the nutrition industry. And so he said, I did not verify, he said that even fecal material was found in the off-the-shelf probiotics. So I I have some handouts for you guys. They are the companies that I use personally and I use with my patients. If you're buying vitamins, buy from reputable companies. Metagenics is a great company. They test pre, during, and post tableting. So you know exactly what you're getting. You do pay for it, but it works. Yes?
I got some probiotics, once in a while I take one. But what the bottle says billions, billions of what, in a pill?
Billions of microbes, yeah.
One pill?
But what they're playing to is the American way of thought.
Yeah.
If a little is good, a whole lot is a lot better. And so, yeah, it's billions of microbes in those tablets. But how do they, package it? How do they keep it alive? There's a lot to that. I personally, with my patients, very rarely ever use probiotics. Because most of the time, most probiotics only have 1 to 3 strands. So then you're going to start to create an overgrowth if you keep taking that. So if you want to take probiotics, you have to do what's called the probiotic parade. You switch different probiotics so that way you're getting a whole bunch of different microbes. Here was his latest. So this was actually a year, probably a year and a quarter, and everything's balanced out. And he doesn't come in actively anymore. About once every 6 months he comes in. We do what's called an MSQ. We see if there's anything starting to look a little bit off, but he knows how to take care of himself. And that's the biggest thing. We want to educate people on how to take care of themselves, how to read labels, how not to get into trouble. If you want a
Yes.
handout,
I'm gonna head over.
you go right ahead. This is us, this is how to take care of us. There's 2 handouts there. The other thing, my wife just started doing something called Shockwave. So since I'm in the musculoskeletal realm, people who have chronic back pain, the most miraculous one I just was with was, we had a patient who broke his back, and after he broke his back, he was out for 2 months. We started to adjust him very gently, and he's in this brace, and he's like, they won't let me get out of the brace. They won't let me get out of the brace. And I was like, well, I'm not going to overrule an orthopedic surgeon. I don't have the authority to do that. I said, but why don't we try the Shockwave stuff, because you've always had a tight back. And he goes, sure, we'll give it a whirl. She worked on him 3 times. And the brace is gone. He feels fabulous. And we are the only company south of Carmel that has a Shockwave machine. Actually, we do a test called a Heidelberg test, and we are one of 3 companies on the East Coast that has it. You can go to Harvard and get it done, you can go to Georgia and get it done, and you can come to me. And that's called a Heidelberg test. When you take that test, you swallow a little pill, and it has mesh on the bottom of it, and it in real time reads hydrochloric acid. Because I want to know if your hydrochloric acid is working the way that it should. The reason why is that is your first barrier to having bacteria spill back into the gut. And we have people on all kinds of PPIs. And PPIs were never, do you know what a PPI is? Sorry. Proton pump inhibitors, acid reflux, the little purple pills and stuff like that. Those things were never meant to be long-term. And when people are taking them and taking them and taking them, the parietal cells in the gut shut down. They won't produce hydrochloric acid. And when that happens, now all of a sudden the bacteria that are supposed to stop at the pyloric sphincter, they don't. They can come back into the gut. And who has heard of what is called small intestinal bacterial overgrowth, or SIBO? That's starting to be a thing, especially in the hospitals and stuff. And that is where they have shut down that hydrochloric acid. There's your gut will see more infections, more toxins than any other part of your body in a day. And so it has a lot of protective mechanisms in it. It's got a physical barrier, it's got a slime barrier called secretory IgA, and those have to be healthy. If they're not healthy, you are always fighting something. So, if you have any questions, I'm happy to answer. Otherwise, take a couple of the flyers. The companies I use are on there. The websites that you can go to get them are on there. They do not sell to the person. If you find Metagenics on Amazon, it is most likely a fraud because people are printing the labels and putting them on their own bottles. And then they're selling them because it is a premium brand. Well, with that, thank you, and I'll answer any questions.
Well, I know it's here, I guess the question is, are your services covered by most insurances? Is it mostly private pay? How is that done?
So the chiropractic services are covered by insurance. All of your functional medicine are not, but if you have a health savings account, those types of things do pay for it.
That would be an advantage. Like you're saying, like a Medicare Advantage.
No, usually it's called an HSA. Health
Yeah,
savings
well,
account.
we've had those, yeah.
So your health savings account pays for it, but like as a chiropractor, the only thing Medicare will pay me to do is an adjustment.
Okay.
The insurance, there's a doctor by the name of Peter Attia, and he has a wonderful discussion with an investment banker on the problems of insurance in America, because we are the only country in the world that has the insurance setup that we do. And our insurance, we're not paying for insurance. We are paying for a discount card. And we have the highest, we spend more than the next 3 countries on healthcare. And yet, if you want to look at the great equalizer, we actually have a great case study in the pandemic, in COVID. If you were anybody else but us, you had a 4 times better chance of living. If you were American, your chances of dying from that were 4 times greater than any other country. So the CDC said, hey, why is this? So then they went in to start to study it, and they found that most Americans carry 3.8 comorbidities. So you have high blood pressure, high cholesterol, poor hormones, whatever. You have 3.8 other diseases always running. Mm-hmm. And why? And then they went back to, it's our
But we
food
have
system.
pills to solve everything.
Yeah, we do. Yes, we do. And that's the way our system is designed. The capitalistic portion of our system is wonderful at innovation. We are 80 to 90% of the medical innovation in the world. But my question is, at what cost if we have the poorest health? So is the innovation really driving health? No. So where are the places that not only are living the longest, but have the best health span? And there's a wonderful book called The Blue Zones, and it was written several years ago by Dr. Butner. And he went around the world and found the places in the world that have the highest amount of centurions and super centurions. So these are people in excess of 110 years old. Okinawa, Japan, Sardinia, Italy, There was one place in Greece. America has one blue zone, and that's Loma Linda, California. Do you know why? It's a Seventh-day Adventist commune. They grow all their own food. They don't eat the way that the rest of the world or the rest of America eats. And so since they do that, then you have 100-year-old women driving people to yoga and doctor's appointments and stuff like that. In Japan, they're climbing mountains and tending their gardens.
Mhm.
And I mean, we pay a high price for our convenience. And we don't know it. I don't want to get political, but I will say, I don't like all that Kennedy says, but he does have a point about the food system.
I was, not to interrupt, but I was listening to some of that. It was like, he was talking about just our McDonald's french fries.
Oh, yeah.
That other country may have 3 ingredients
Yeah.
and our country has 11.
Yeah.
It's
Like-
like the Cheetos and stuff that.
Oh, yeah.
That coloring on the outside of it.
It's toxic.
I mean, it's like.
So,
Thank you for taking this time to look into the health of you and your loved ones. This broadcast does not constitute a doctor-patient relationship. It is intended for educational and entertainment purposes only and is not a replacement or substitute for care. If you are having issues, please seek a qualified professional trained in functional medicine. We would be happy to be of assistance with both in-person and virtual consultations. Thank you.